Good afternoon and welcome to the first webinar in the Virginia Hospital and Healthcare Association's 2019 High Reliability Organization Brown Bag Webinar Series. My name is Abraham Segrist and I'm the Vice President for Quality and Patient Safety at the VHHA. On behalf of the VHHA Center for Healthcare Excellence and the Virginia Patient Safety Organization, we would like to welcome all of our colleagues from across the state to the third season of this monthly webinar series featuring successful strategies from Virginia hospitals and health systems promoting safety culture and high reliability. I'm very glad to present to you today our colleagues from the Inova Health System in Northern Virginia in their presentation entitled Walk in My Shoes, Understanding Patient Safety at the Front Line. Our presenter today is Kathy Helak, Senior Director for Patient Safety at Inova. After the presentation, we hope to have a few minutes for questions, and so we encourage you to submit your questions using the question box feature in the webinar platform. So Kathy, without further ado, we'll turn the floor over to you. Kathy?
Great, thank you so much. I appreciate the opportunity to share some of the work that we're doing to continue our journey in high reliability, and a simple program that we've put in place over the last year that's called Walk in My Shoes. This program has really helped us to stay connected with our frontline team members and understand their work in a new way, and so I'm happy to share that today. Just to give you a brief understanding of the Inova Health System, we are a not-for-profit healthcare system located in Northern Virginia, and we serve the Metro DC area and beyond. We serve more than 2 million people each year in this region, and our team is over 17,000 strong with more than 5,000 nurses and 4,600 physicians associated with our team. We're also very proud of our comprehensive network of 5 hospitals, our outpatient facilities, primary and specialty care practices, and a variety of health and wellness initiatives going on. You can see our 5 comprehensive hospitals in this picture. On the eastern region, our Inova Alexandria and Inova Mount Vernon campuses serve that area. In the western region, we have Inova Fair Oaks Hospital and Inova Loudoun Hospital. And then Inova Fairfax Medical Campus is the flagship hospital for the system, which is also the home of the Inova Children's Hospital, the Inova Women's Hospital, and the Inova Heart and Vascular Institute. The Fairfax Medical Campus also is a level 1 trauma center with a very robust organ transplant program, which includes kidney, heart, lung, and pancreas. We've been on the journey to high reliability for many years, and we have been fortunate through exceptional care delivered by our teams across the system to receive many recognitions, which we're proud of, because these really do show that we are delivering safe, high-quality care to our patients. Most recently, we're very proud to share that all 5 of our Inova hospitals received A grades from Leapfrog during the fall of 2018, and you can see a variety of the additional awards that we have received. And knowing that we are on the journey to high reliability, we know that these awards are great recognition, but we still have more work to do. So this is a wheel of high reliability that we have used with our frontline staff at some of our hospitals. And you can see that it's very simply outlined with the principles that are in place for HROs. And we have, across our system, had a variety of tactics in place that help us every day on this journey. We have daily safety huddles, which many hospitals have, that help us to keep that preoccupation with failure and stay focused on what's going on operationally being situationally aware of what's going on at the front line, and having leaders from across each campus be involved to share transparently what's going on in their department. We have leader walk-rounds in a variety of different ways where our leaders are out talking with frontline staff, hearing their opinions, their concerns, and learning about the success stories that are going on. Our commitment to resilience is really through the incredible support our team provides in continuing to report so that we learn and understand what's going on with errors, great catches, and even operational issues that tell us that we have opportunities in our system designs and processes. And we have, our teams are very involved, our frontline staff are very involved in the root cause analysis process and a variety of other performance improvement types of activities. We know that our safety culture survey and also our engagement survey help us to get feedback from our staff so that we understand what are their beliefs about patient safety and the work that's going on so that we can continue to really build that trust and address errors in a fair way. And then finally, in our tactical plan right now, you know, we have a lot of different ways that our frontline staff are involved in helping to improve patient safety through CUS programs or the Comprehensive Unit Safety Program model, various practice councils, safety coach programs, and improvement teams. So we have a lot of different things in place across the Inova health system that help us to hear from frontline staff, allows them to share their ideas and really be involved in the problem solving. But we also understand that the work at the sharp end is quite daunting, and there's no single perspective that's really going to provide the entire truth about what normally goes on during the busy shift and in the care of a patient. I'd like to just mention also that part of our commitment to high reliability is creating highly reliable teams that perform well. And we have made a huge investment in team steps as well as just culture. Our commitment to patient safety through team steps can be seen in a variety of programs offered across the entire Inova system for new employees, refresher programs, specialty classes that help our teams to really continue to focus on better teamwork and better communication. Our Just Culture model of a shared accountability has helped us really to improve the reliability of our system design by encouraging people to speak up, feeling that they're treated fairly and justly when an error does occur, so that we are focused more on why things happen rather than who, and really understanding what's going on at the sharp end. The reason I mention these is that we have two significant strategic priorities at Inova. The first being creating an exceptional patient experience, and the second being creating a great place to work. And we feel like our team steps, investment, and our focus on just culture help us to create those as well as our high reliability. But each day as we learn with our safety reporting system and we do talk with our staff, I think one of the challenges that we face is the question of, is the care really safe today, and what might be that next error that's going to occur? It's increasingly easy to oversimplify what's going on out at the front line with all the nuances of getting the job done. And I think our focus on preoccupation with failure has guided us to really try to ask this question on a daily basis to understand, is patient care really flowing the right way, reliably, or where are those nuances that we might need to modify? So do we truly understand the resources needed at the bedside in the course of a shift? Do we understand those distractions or interruptions? Do we appreciate how our training really is impacting the success of the frontline staff to do their work. And what kinds of communication mishaps may be seen at that front line that help us to see what kind of errors occur. So there's lots of obstacles along the way that we don't necessarily always see in our safety reporting mechanisms, and often might not be reported as part of the discussions we have in leader walk-rounds or in our huddles. We wanted to create an additional lens that would help us to get out to the Gemba and really understand situationally what's going on with a different eye-opening exposure. So we wanted to move to understanding work as done instead of just the work as imagined. And I think, especially as leaders, it's easy to think that the course of a day, the course of the path of work that has to be done by the frontline staff is going to go smoothly. And oftentimes we know that there's a lot of detours. And what our program about Walk in the Shoes is all about is trying to help us really understand what are those detours that are occurring and how do these create complexities in getting the work done. What are the different kinds of workarounds or shortcuts that people might experience as a result of all those detours? And so we created a new program that's really intended to just do that, to understand what normally happens in the workplace. How can we better understand the resilience of the team? What are the changing circumstances that they might be facing? And really getting a greater understanding of the operational know-how around the constraints, what motivates people or incentivizes them to do the work the way they do, and also drives some of those behavioral choices. That's very different from understanding work as imagined, which is really thinking that the work is simpler than it is, and possibly being blinded to some of the challenges that our team faces. Excuse me. And I'll just speak for a moment with my own experience in this program. As a critical care nurse, my past experience is very helpful in understanding what the ICU environment is like and what that care might look like. But the reality is that my experience is probably outdated to what the real care of a critically ill patient is today. And so it's important to recognize my blind spots, my biases based on my own personal experience as a nurse, my own knowledge and exposure, so that we can truly understand what is that real work environment today, what are those unintended consequences and constraints that might lead to some of the workarounds that oftentimes push people away from the standard work, following the policy and procedure, and so forth. So Walk in My Shoes is really a very, very simple approach to trying to bridge the gap between work as imagined and work as done. And it's our belief that it really is an authentic presence and creating that curiosity as a leader to learn what's going on at the front line, recognizing that we don't really know. And it's a chance to create a real-time experience that's an adjunct to all of those other great tools that we have in our high reliability toolbox that often don't really tell the whole story. So Walk in My Shoes is the opportunity to really see things just through a different lens. I really love this book, and I wanted to share it because I think this quote is very important to this tool. Edgar Schein says in his book, humble inquiry embodies accessing your ignorance and becoming open to what may be learned from each other in the actual situation through observing, genuine, open, empathic questioning, careful listening, self-inquiry, not judging, but suspending judgment and shifting helping roles as necessary. And so this has really been a framework that we've used to really move to that idea of being not the leader to gain information, but being a learner to seek to understand at a greater level what's going on at the sharp end. So the biggest thing that this requires from us as leaders is really time and that idea that I'm going to take my leader hat off and put my learner hat on. And I know it's very difficult. Everybody has busy schedules, but one of the things that we have found works very well is making this a priority on the schedule. And so blocking a set amount of time several times a month that makes sure that this is built in as a priority on the schedule so you can devote the time. Another great way to make this work is to ask permission ahead of time. And so rather than showing up on the unit to do rounds, what we have found works well is to contact that leader ahead of time and ask permission to come and be on the unit for that set amount of time. Put some scrubs on so that, again, you're becoming that learner versus that leader, and not having an agenda. And I think that that's been the most powerful part of the experience that we have seen, is that when we go to a unit, staying open-minded and curious to just learn and see what happens. And as things come your way that might relate to a specific policy that you're working on or a new process that you're putting in place, you can take note of that. But most important is to go with an open mind and no agenda so that you can learn. At the end of each experience, we also do focus recognition. So we take time to acknowledge what did we learn from the frontline team member that we had the chance to work with. You know, what kinds of things will help us to be better as patient safety leaders. And then finally closing the loop with the leaders that oversee that department. So we do not only a verbal focus recognition with the individual and their direct supervisor, but then we follow that up with an email to the leadership over that area, just to express our gratitude for the opportunity to learn and some recognition of the positive things that are going on in the unit. One of the things that also comes from this opportunity is a chance to really see so many great things that are going on. And so oftentimes myself as a patient safety leader, you know, I see the things that are mishaps, that are the potential errors or process failures. But when you get out there and you walk in the shoes of the frontline staff, you have the opportunity to really see a lot of great work going on that really reinforces all the good things that are going on, as well as where there's opportunity. So I thought I would just share, these are just a few examples of things over the last about 10 months since we've been doing this process that we've had the chance to observe. So in the ED area, the opportunity to not only be engaged with the frontline triage nurse who's working with patients as they come back to that area, but seeing what goes on with registration and volume surges and some of the challenges that the team faces with the complexity, diversity, and acuity of patients, especially around language barriers. In the ICUs, it's been impressive to see the variety of different types of equipment that the staff are using and some of the adaptive mechanisms that they put in place when they don't have all the resources necessary to make sure that the equipment works effectively. Being up in some of the general medical units where you have the chance to watch the organizational skills of the frontline staff, and you get to see different practices at the bedside. What are they doing with central line dressings? How do they respond to a patient in isolation? We've also gotten the chance to participate in different rounds on the unit amongst the entire team, which we call trio rounds. And that really gives you a chance to understand the communication amongst the team and how they really are working very effectively and how the families and patients are involved. We've even had the chance to see down in our sterile processing department some of the challenges that go on with their workflow and how that can lead to failures and gaps in the proper labeling and storage of trays and the cleaning processes. So because of going to each of the areas that we've had the chance to visit with our scrubs on, an open mind, no agenda, we really do get a chance to see a variety of different parts of the day of a life of a nurse or a technician and so forth. And it gives us an opportunity just to make sure that we're staying close to the front line in terms of what their work is. So as we wrap up, just a couple things that we'd like to share in terms of some lessons learned. And I think that this is so important to our work around high reliability and patient safety. It's truly understanding the complexity of workflow and following an individual team member as, you know, they have multiple phone calls and multiple things pulling at them during the course of their shift. Seeing hassle factors that they deal with in terms of delays in different things being delivered to the unit and how do they manage that, and their resilience to really continue doing all the things that they need to do. It's been helpful often in some of these different areas to see the number of steps and the complexity of the processes and designs of some of our systems. And so we have good takeaways in terms of where there's really the need for us to decrease that complexity and reduce the number of steps so that we can gain greater reliability and decrease some of those workarounds. I've been impressed myself with the adaptability of our team members and the strong critical thinking that goes on each and every day as the staff are really working through all those detours in the course of their shift and taking care of their patients. Lots of great teamwork, and as I said, the opportunity to really see how is our team steps communication program and our team training really being applied out at the bedside and amongst the various team members. And then in terms of safety, just getting to see really what some of those gaps are and understanding the whys of the work being done at the bedside and where there's opportunities for us as leaders to continue to understand the sharp end and continue to make changes in processes with the assistance of the frontline staff so that we can really make it a better work environment for them and decrease some of that complexity. So I would just say that walk in my shoes is not a complex process. It really just requires the discipline of time and the discipline of an open mind to really just continue to be preoccupied with failure and understanding the details of what's going on at the front line. So making it a priority to really understand those details. It's really helping us to understand the adaptability to the various nuances in the course of caring for patients and the critical thinking that's involved. It's been great to be able to listen to what the staff have to share and staying open-minded and curious about what we're going to learn. that humble inquiry from the most expert resource. I can tell you that our frontline staff, when they have the chance to be the teacher for their leaders, it really is a very positive experience, and we have seen that as our staff enjoy the opportunity to show us their work. And we have staff that say, well, when are you going to come and walk in my shoes so that I can show you the work that I do? So that's been very rewarding to have staff come and ask us when we're going to go and see them next. And I think, you know, the last part of this is that true sensitivity to operations, that we understand the work is done, not the work as imagined or prescribed. And so with that, I'll just say it's been a great experience for those of us at the Inova Health System that have been able to build this into our schedules. Very positive for our frontline staff. I think it helps us to be a better patient safety leader and to stay connected with understanding the work that's really done at the bedside. So let me stop there and say thank you again for the opportunity to share this simple tool.
Kathy, thank you very much for your time today and for sharing with us some of the great work that's going on up in Northern Virginia at the Inova Health System. We've got about 2 minutes for questions. So before I check to see if we have any questions, just a couple of final housekeeping reminders. We are recording today's webinar, so the recording of the webinar as well as the slides will be posted on the VHHA Brown Bag webinar page on our website. So it may take us a couple of days to get that on there, but for folks that want to have access to those materials, we will have them posted there. Kathy, as I look, I don't see any questions currently posted in the question box, and folks can type them in if they would like to. But I do have one question, Kathy. We're always intrigued by how multi-hospital systems are able to share lessons learned from one hospital to the other. And so are you able to maybe speak briefly as to how you all within Inova are able to share what you might learn at one facility and make sure that that learning is appreciated by your other facilities? Do you have a standard process for sharing that information?
We have several standard processes in place. We have a system quality committee that meets on a monthly basis, and that's an opportunity for each of the hospitals to share various activities that are going on, various events and lessons learned. One opportunity that we have found to be very effective is on a weekly basis, the patient safety team across the Inova Health System does a conference call. We meet on a regular basis, but this weekly check-in is our chance to share anything hot off the press, lessons learned, takeaways from experiences like this. So we do have a variety of different forums that are used. Those are just a couple of them.
Great, thank you very much. That weekly touch base sounds like a great idea, just to see sort of what's hot and what's happened the past week. Well, I don't see any other questions in the box at this time, Kathy. This was an excellent presentation. We always appreciate you all willingness to share with the rest of the Commonwealth. And again, for our audience, this is the first of our monthly webinars that we'll be hosting throughout the entire year of 2019. And if there are no other questions, looks like someone tried to slip one in. Teresa, can you open that box? How do you drive changes based on what you find in your walks? So we're slightly over time, but if you can maybe quickly speak to that, and then we will end the call. But how do you drive change based upon what you find in your walks?
That's a great question. And the first thing to do is to share the observations with the individual leader of that area. So, for example, one of the focuses across Inova is our reliability around patient identification. And in my most recent walk in my shoes experience up on one of the medical surgical floors, I had the opportunity to see the patient ID not being used the way that we want it to, and the discussion between two team members using room numbers versus the patient's proper identification. So that type of information I take back to the frontline leader in terms of that observation. And then I also share that across the different forums that we have so that we can look at, is this an isolated situation, or is this something we need to go back to training around, what we're doing with a particular focus area. In this case, because of the two staff members that were involved, I would take it not only to the individual leader of the unit that I was on, but I'd also take it to the leader of the other department. So they can go back in their huddles and they can reinforce the importance of, when you have these types of interactions with your colleagues up on a department, you're going to use proper patient ID. So I think it's really important, regardless of what the observations are, and many of the observations are very positive, is closing the loop with the leader of that area or the leaders involved with that interaction, so that they appreciate, that observation and perspective. And we have found that leaders are very grateful to have that walk in my shoes perspective, because it's just, again, another set of eyes and ears that helps them to see where there may be an additional opportunity to retrain, remind people, look at the system process that contributed to that situation. So it's very important to close the loop, and there's different ways to do that.
Well, Kathy, that was a great question to end a great webinar, and really reemphasizes the importance of getting out there and understanding and appreciating work as imagined versus work as it's actually occurring, and knowing the difference and being able to follow up. So thanks to our colleagues for that question, and thanks everyone for joining us today. We look forward to seeing you next month on the 4th Monday of February for our next High Reliability Organization webinar. Have a great week, everyone, and hope to see many of you in Richmond at the end of the week for the 2019 Patient Safety Summit. Thank you all very much, and have a great day.